Hey everyone, it's Sam in Mule Media. I'm out here at SHOT Show 2025 at the Rescue Essential booth. I've got Ron with Clot, and what we have here is the chest seal trainer. So if you'd like to give a little information.
Sure. Our chest seal application trainer comes with quite a few things for this. So we could do this as a crawl, walk, run training aid here. So for crawl, all we're doing is we're handing a student a pair of gloves and a chest seal. And what we do is we have them put the gloves on, open up the chest seal, simulate wiping in the chest with the piece of gauze that'll be in the chest seal itself. And then we watch the student, when they go to put the chest seal on there, get stuck on their gloves. That's okay because that's the crawl phase. So they work through that and they build up that muscle memory and the confidence of actually putting it on. But then as we go to walk, when you look at the wound there, this is not arterial venous bleeding. This is the frothy blood and air mixture that's coming through. And it actually makes the noise. Kind of hard to hear in this loud room here, but we simulate that, the bubbling. And again, we'll give the student a pair of gloves, a chest seal, one of the blue trainers there, and we'll actually have them wipe it, and we'll have them apply the chest seal itself.
So if you've never used a chest seal before, they always have cloth on you. So you go ahead and start cleaning this away, and they could continue to bleed as you're wiping it away. You want to get the majority of this off so you can get a good seal on there. So as you take it, as you can see, with the blood on my hand, it makes it a little difficult, but you get it in there. And as you can see, as I'm applying it, as you get that frothy blood coming in, it's going right through the 3 channels there. So you're going to get it out there, but that's completely fine.
And here's a good thing we can do. If we have to do a little remedialization, the chest seal trainer, the chest seal actually comes right off. So I can quickly wipe it down and then have the student reapply it, making sure that it's all smoothed out. So Sam, why don't you try to smooth it out a little more so we can show how the channels on this hyphen chest trainer.
Also simulating burping if you need to. Clean that area, reapply. And then with the trainer, it also comes with the second part where it shows an exit wound. Not all injuries are going to have an exit wound, so sometimes you may only use one. You may use both. The great thing about this compared to some of the expensive training dummies or mannequins is it's not in one location. You can actually put it in several different locations. With each different student, they have an opportunity to treat the wound at a different location.
But Sam, another thing we can do with this trainer is we can simply take the chest seal off, we can wipe it, reapply it. And again, because this is a tabletop exercise, we can reuse this. So this actually pays for itself pretty quickly because I can use this for quite a few evolutions. Now, how do we take this to run? Run, it comes with a hook and loop vest that goes on. The attached trainer is the exit wound and the entrance wound are hook and loop. So now we anatomically can put that wherever we want. Unlike your high fidelity mannequins where the hole's always in one spot, you can't change it. We dictate where we want to put that on there. So you'll see that it also comes with a mini hydration system, so that actually fits in a front pocket. So now your role player, in addition to kicking and screaming, they can also simulate inhalation, exhalation on the attached trainer itself. So another good part of this, you already saw about how it comes out and the noise that it makes, and you actually just saw some of the spurting. But now watch how the system works. The way that the system is on here, it's starting to withdraw the fluid back in to simulate the patient's inhalation. And you'll see that the fluid starts to draw back in. And then when it gets to the point where it sucks in most of that, you actually get that sound there. Now, for anybody that's ever treated a sucking chest wound, I'm going to tell you it's spot on. So our developer, Brad Day, did a phenomenal job when he replicated this.
So the great thing with the training apparatus here is for those who've never dealt with a sucking chest wound, it at least gives you an idea. So for someone who's never done this before, or they're learning, or even those who have been in the know for the training and never actually applied it, it gives you a better mindset to know, yeah, that's exactly what it is. Ron, I got a quick question on this.
Absolutely.
As we're using chest seal trainers, how's this work with improvised chest seals, such as you use a Dorito bag and some tape to get that going? Because while most of us who are in the prepared community, medical, law enforcement, we always carry it. I've got it in my backpack here. Situation where there's multiple injuries, I don't have enough chest seal. I know how to do an improvised chest seal. I've done them before.
Yep.
So how does that work with this?
So I'm a garbage collector. When I was treating casualties, I would never just throw this in the wind. Stuff like this would go in my pocket because what is this now?
It's a chest seal.
That is your chest seal. What am I missing? What else do I need to make this effective?
Just throw some tape on at least 3 sides there.
Yep, your 2-inch surgical tape. Boom, you now have a chest seal. So with the hyphen seal here, I have now 2 additional occlusives.
You can run it on the entrance and the exit if there is one. And it's also a great way to learn how to burp it.
Right, and if I had to, I could use that. Not really ideal, but I would much rather use the foil. Yeah, this is a phenomenal tool. I love it. You can also, if you have rescue Randys or whatever, you can use this using the vest. Again, I do prefer live role players because they kick scream, they give you that effect.
And for those with the clothes that are worried about staining, True Clot, when it comes to this, is safe on the clothing material. It does not stain like a lot of other fake blood and some of the training materials. So if you're looking for that, if you're within the Stop the Bleed, law enforcement, paramedic, any type of job where you are actually training and learning this stuff and teaching other people, another great tool from True Clot.